Spinning is fun. It's a good time. Unless, of course, you don't want to be spinning. Hi, I'm Dr. Michael Berglund. I'm here to talk to you today about a subject called vertigo. Now, vertigo is a condition that describes a spinning of the room or a dizziness. The first thing we have to talk about, though, when it comes to vertigo is the ear. And you think the ear isn't, well, how does that have to do with equilibrium and balance and all that stuff? It has everything to do with it. Let's talk about it. There are 5 parts of the ear that, for our discussion purposes, that we're going to talk about today. The first part is the outer ear, which goes all the way up to the eardrum. The second part is the eardrum. The eardrum is located between the outer ear and the middle ear. Now, the eardrum is simply what it sounds like. It's a membrane that's pulled to the surrounding tissue, okay? And that vibrates when sound hits it. On the other side of the eardrum, there are some bones that connect, that touch the eardrum, and they vibrate, and they send signals to another bone, which sends on to another bone, which sends on to the nerve, which goes to the brain. That's how you hear. The third part is the middle ear. And that's where people, when they have ear infections, that's usually the point where they have ear infections, is the middle ear. The fourth part is the inner ear. Now, the inner ear has a little bone that's shaped like a shell, and it's called the semicircular canal. The semicircular canal is just what it is. It's a canal. It's like a shell, and it has a canal running through it. And along that canal, it has little hairs. And those hairs have also, next to them, it has a fluid level. And when you turn a certain way, the fluid level tries to stay parallel to the ground. Your brain is attached to nerves, which are attached to those hairs, and they detect where you are in space. That's why when you spin around in a chair and you stand up, or on these YouTube videos when they put the bat on their head and they spin around, and then they try and go do something and they fall to the ground and hit their head on the concrete and bleed enormously, that's why. Because theoretically all that fluid is still on all those hairs, and the brain has no idea where things are. The last part is a tube draining from the middle ear called the eustachian tube. The eustachian tube is attached to the middle ear and drains out into the back of the throat. With vertigo, we're mainly talking about the inner ear, where that semicircular canal is. Now, at the core of everything, there is a fluid problem. Almost always, the reason your ear gets messed up is because you generate too much fluid. Now, what is fluid? Mainly, fluid comes in the body when the body tries to protect itself. When we have a cold or allergies, our nose runs, our eyes water, the body tries to flush itself out. It knows there's a virus up there, it knows there's an allergen up there, and it tries to flush itself out. The inner ear, the middle ear are no different. In the outer ear even, wax is the material that it uses to try and protect itself and push things out, and it gradually kind of goes out, then you end up with, the wax. That was nice, wasn't it? Wax. The idea is, in that inner ear and middle ear, the fluid will build up. Now, normally that's supposed to drain through the eustachian tube. That fluid drains down that area. That has to happen. Eustachian tube is why when you have, when you go scuba diving, they always warn you about not going too fast and let your body equilibrate, they talk about. Or when you're up in a plane. How many of you sit there and gone up in a plane and you go, oh, my ears feel weird, and you go, and you pop your ears? Well, I'm blowing outside air, the outside pressure air, into my ears to balance them. Okay, I'm opening up that eustachian tube. Air can go up like that, but also the key is fluid should be able to come down. Now, in my office, when we have congestion, one of the things that I'd like to do is adjust the ear. So I'll just take the ear, apply some pressure, and pull on it. It helps the eustachian tube drain when it gets stuck. Now, most of the time, the problem isn't that things aren't draining well. The problem is you're making too much fluid. And that's your body's way of protecting itself. And usually we're talking about food allergies or sensitivities or airborne allergies and sensitivities. My main thing that I want to do when it comes to that stuff is control the fluid production. The biggest thing you can do is eating clean. First of all, you have to figure out what your food allergies are. You have to figure out what causes your body to make more mucus. Once you do that, generally, people get less and less problems with vertigo and ear infections and ear fluid because they've taken care of things from an allergy side of things. The second one is there is an infection in there, and sometimes there is. If that's the case, there are natural antibiotics. There's also antivirals out there. Vitamin C is an amazing thing. It's great for stimulating the immune system. It's great for supporting the adrenal glands, but it's also really good as a antihistamine. You know, histamine is one of the reasons why our body makes the fluid in the first place, and it decongests it. It removes the congestion. It actually dries up mucus. The challenge is you got to use vitamin C in higher doses. Google how much vitamin C do I need, or how much vitamin C can I use, and you should be able to figure that out. Anyway, I feel bad. I know vertigo is a horrible thing. If you're suffering from it, I feel bad for you. And if you've had chronic cases of this, I just want to know that there is help for you. There are solutions out there. Thank you very much for watching, and I appreciate your time. God bless.